Hello class, my name is Luz Flores. Today I'm going to share with you all a quality improvement initiative or gap I found in my facility, which is University Medical Center of El Paso. I'm going to describe the initiative and why is it important, the goals we are trying to achieve, how the initiative will be measured, and how the nurses and other multidisciplinary teams can get involved in the timeline and budget for the initiative. One of the gaps I found at UMC is in documentation, especially in pain assessment and reassessments by the nurses. The documentation is either incomplete or not done at all. Complete and accurate pain assessment and reassessment is very important as it is a mean of measuring customer satisfaction. The funds and reimbursements we get from Medicaid and Medicare are based on customer satisfaction scores. Also, CMS focuses on pain assessments and reassessments. The evidence used to determine that the quality improvement was needed was based on daily performance improvement or PI daily chart audits and low scores in patient satisfaction regarding pain management based on patient surveys after getting discharged from UMC. The goal of the initiative is trying to achieve is complete and accurate documentation and compliance by the nurses and increase patient satisfaction scores regarding pain management. The standards that are met by the initiative are the following. The Joint Commission standards. They require comprehensive clinical assessment and reassessment of pain. The Centers for Medicare and Medicaid Services, or CMS, clinical standards. They require the assessment and monitoring of patients receiving medication to determine whether the medication results in the therapeutic intended benefit and to allow for early identification of adverse effects and timely initiation of appropriate corrective plan. Also, the National Database of Nursing Indicators, or NDNQI. They review data and evaluate nursing performance and improve patient care. The quality indicators that will be used to measure the improvement of the initiative will be by the increased percentage of accurate and complete pain assessment and reassessment documentation done by the nurses, evidenced by an increased percentage on daily and monthly charting audit the results, and through the patient surveys to see an increase in patient satisfaction scores regarding pain management. These quality initiative indicators would support the initiative by providing evidence that nurses are being compliant with the required documentation and that the patients will be provided with better pain management so that when we get audited by the different organizations, we provide evidence that the requirements are fulfilled so we can continue receiving funds and reimbursement. At UNC, the data is collected by the Performance Improvement or PI coordinator of each unit. Our PI coordinator serves 3 units at this time: the trauma ortho, women's surgical, and the surgical units. The PI coordinator collects data on a daily basis by doing chart audits on all 3 units, and this information is reported to the unit manager. Every 3 months, the PI coordinator from all hospital units report data and make comparison between units. Then the data is submitted to the Quality Improvement Department for review and comparison to other hospitals in the region. The Quality Improvement Department reports the collected data to Joint Commission and CMS. The nurses' involvement in helping with the initiative is very important as they are the ones doing the documentation. By the nurses being compliant with the documentation, the goal of the initiative is fulfilled. Also, nurses provide feedback regarding the challenges that they face when documenting and can help develop a plan of action to correct the gap along with the PI coordinator and the nurse educator of the unit. The PI coordinator and nurse educator provide data and education regarding the value of complete and accurate documentation. Other than the PI coordinator and the staff nurses, the other multidisciplinary teams involved are the pharmacy department by providing a list of which pain medications are required to have pain assessment and reassessment, the nurse educator which educates the staff, the unit manager that addresses and reinforces the initiative, and the quality improvement department that collects and reports the data. At UMC, there are some challenges that we face in meeting the goal. There is resistance from the nurses They often complain that there's too much documentation to do. In our units, most patients are in pain and require multiple pain medication administration throughout the shift. Therefore, documenting pain assessment and reassessment can be overwhelming at times. Most nurses don't understand the value of proper documentation as it is a requirement from governmental agencies so we can continue to get funds and reimbursements. Also, we currently have a lot of travelers nurses and PRNs that don't adhere to the hospital requirements. Nurses can help alleviate these challenges by documenting as required. They can also get educated regarding the importance and the requirements regarding documentation and also maintaining compliance with the nurse scope of practice. In order for a nurse to suggest a change, she or he can communicate with the PI coordinator and nurse educator of the unit so that the change can be evaluated. Then the suggested change is submitted to all hospital committees for review. The committee submit the proposed change to all hospital departments and they all have to agree and sign the change. The departments that assist with the modification are the PI coordinator reviews the modification, the nurse educator suggests modification, the pharmacy department also reviews the modification, and the unit managers provide feedback. To get the other departments involved, information can be shared between units, suggest ideas, meet on a regular basis, provide feedback, compare data, and implement a plan of action if needed. What is hoped to accomplish with the modification is nurse compliance with documentation, complete and accurate documentation, adheres to national standards, increase patient safety and satisfaction, and to continue to receive funds and reimbursement. At this time, there's no specific budget to address this problem. The PI coordinator, nurse educator, and manager of the unit work in conjunction on a daily basis and implement the plan of action according to needs. The expected timeline for implementation of the initiative is 3 months. This timeline is based on the Quality Improvement Department that requires data collection and reporting of the results every 3 months. At the end of the 3 months, the initiative will be evaluated based on the percentage documentation compliance by the nurses and the scores based on patient satisfaction regarding pain management reports. Thank you so much for watching my video and I hope that you guys learned a little bit from it. I know I did learn more about the importance of complete and accurate documentation. It is not only necessary to deliver quality patient care, but also for funds and reimbursement purposes. Thank you.